Hi and hello everyone. Welcome to the Nursing Virus YouTube channel. This is me Loganathan and this video regarding the CRPF solved question paper from the year of 2014. The completely solved question paper I am going to present on this video. So this is the original question paper. For my convenience, I made in that PowerPoint presentation. So we'll see the complete rationale for each question and answers. And so far, if you're not subscribed my channel, don't forget to subscribe and click the bell icon. So you'll get all the MCQs videos with the rationals and as well as job notification around the India. We'll go for the discussion. I have discussed the part 1, the first 25 questions in the part 1. So you can go and check it on that video description or the playlist. Here, question number 26. The protein found in the soybean is called gluten, leucine, lactalbumin, and glycine. So here the correct answer, glycine. So the rationale is the soybean contain a small but newly very significant 2S albumin storage protein, legumes protein such as soya and in the bulbs. Belongs to the globin family. It is a kind of an seed storage protein called legumin and vicillin, or mainly in the case of soybean, which they given on the question paper, the glycine and as well the beta corn glycine is mainly present on the soybean. So the correct answer is D. The question number 27. Which food group of the following is basic food group? Fruits and vegetables, wheat and whole grains, fat and oil, egg and meats. So here the correct answer, according to the food pyramid, the wheat and the whole grain is the basic food for every human being. The remaining food items which they given on that food pyramid, that is the hierarchical based needs for every individual human being. So the wheat and whole grain is important one and it is called as basic food groups. And the next question. High rays entering the eye is controlled by which part of the eye? That is a pupil, iris, cornea and lens. So here the correct answer is pupil. The rationale is the contraction of the iris muscle control the amount of lights entering the eye by adjusting the size of the pupil. A hole shaped opening in the middle of the eye. Here in the picture also you can see that is the iris. Since iris control the amount of light entering the eyeball by the pupil area. Here you can see the pupil. So this is the area where controlling the high rays entering into the eye parts. So the next question. Which cranial nerve has the highest number of branches? The options are vagus nerve, facial nerve, trigeminal nerve and none of the above. So here the correct answer is vagus nerve. The rationale is, so here the vagus nerve is one of the 10th cranial nerve in our body. Here the vagus nerve having the highest number of branches and as well this is the considered as longest cranial nerve. Suppose if they are asked as largest cranial nerve, you can go with the option the trigeminal nerve. But here they asked about the highest number of branches. So the vagus nerve is the correct option. Here it contains motor and sensory fibers and because it passes through the neck and as well to the thorax and it is still passes to the abdominal area. So it is the widest distribution of nerve in our human body. So the next one. Side effects of Haemophilus influenza vaccine is lethargy, urticaria, low-grade fever and generalized rashes. So the correct option is lethargy. So here I given that all the list of side effects towards the hip vaccine, that is the pain and redness or swelling at the site of injection and the person have the high temperature, irritability, sleepiness and loss of appetite and as well the lethargy. So among the given option, the lethargy is correct one. The next question, which of the following is not the future of life? Growth, responsiveness, reproduction, and organ system. So here the correct answer is responsiveness. So this is the option is not belongs to the basic of that human life future. So the next question, what is Audinophagia? The options are difficulty in swallowing, pain during swallowing, and unable to swallow, and regurgitation. So the correct option is pain during the swallowing is called as Audinophagia. So next one, 33. Which of the following condition is less likely to cause stomatitis? The options are nutritional disorder, chemotherapy, heart failure, and allergies. So here the correct answer is heart failure. So first we should know what is meant by stomatitis. Stomatitis is nothing. It is a kind of condition that cause painful swelling and sore inside the mouth. So that is called as stomatitis. And they asked what is the reason for causing the stomatitis. So here I given all the list of the causes for the stomatitis. Here the dry mouth and serostomia, viral infection, and Candidia's albicans infection, trauma including surgery, and smoking tobacco, and toxicity of the chemotherapy drugs, and therapeutic radiation for the oral cancer. So these all things will use to cause the stomatitis, like a nutritional disorder, like an chemotherapy and allergies, except that heart failure, the remaining all will cause the stomatitis. Then the next one, hematological abnormalities include branches. So the vagus nerve is the correct option. Here it contains motor and sensory fibers, and because it disorder or abnormalities. It's a very easy question. The correct option is anemia. This is one of the major problem under the hemolytic abnormalities. So the remaining three problems were included in the genitourinary problems. Next question. Gallows traction is used for, the options are fracture shaft of femur, fracture neck of femur, fracture humerus, fracture tibia. So here the correct answer is the fracture of shaft of the femur. The gallows traction will be commonly utilized when that fracture were happening on the shaft of the femur. On the image also you can see the method of treating fracture of the thigh, that mainly the shaft bone, especially in that young children who are having below 2 years of age group. After applying the particular traction on the thigh area, the skin traction is applied to the both legs and the child is suspended from the beam so that buttocks are just clear of the bed. So it will be hanged like this for making that gallows traction. So next one, which of the following lifestyle factor is most closely related to the bladder cancer? Sedentary lifestyle, drinking 2 bottles of cola daily, smoking 2 packs of cigarettes daily, living in the industrial area. So the correct option is smoking 2 packs of cigarettes daily. So the reason is smoking is the most important risk factor for the bladder cancer. Smoking are at least 3 times likely to get the bladder cancer comparing with the non-smokers. When they are making comparison on that the bladder cancer, the smoking will be the reason for half of the all bladder cancer for both gender. So the next question, enlargement of thyroid gland occur in which condition? That is hypothyroidism, hyperthyroidism, tumor of thyroid, and all of the above. So here the correct answer is all of the above. Even when the thyroid hormone were either getting increased or decreased, the thyroid gland will used to get enlarged. And even for the tumor of thyroid also, the gland will used to get increase in size. So the next question, which of the priority nursing assessment in the first 24 hours after admission of client with thrombotic CVA? The options are pupil size and papillary response, cholesterol level, echocardiogram, and bubbles asking. And in the case of thrombotic CVA, what is your nurse's assessment in the first 24 hours? So here the correct answer is pupil size and papillary response will be an correct answer, or that priority based care we can provide for the CVA patient. So here the reason, it is the crucial to monitor the pupil size and as well the pupillary response, mainly to indicate the changes around the cranial nerves of the human body. The remaining options like an cholesterol level mainly needed for the long-term rehabilitation when you are going for the CVA patient, and the echocardiogram is not needed in case of thrombotic CVA, and as well the bubble sound also need to be monitored, but it is not highly prioritized in the first 24 hours of the period. So the first option we can go. So the 39, which of the following condition is most common form of hyperthyroidism? That is, options are Addison's disease, Cushing syndrome, and Graves disease, and Hashimoto disease. So the correct option is Graves disease. So this is the major common problem will used to happen due to hyperthyroidism. It is a kind of an autoimmune disorder, so which the antibodies produced by that immune system were mainly stimulating the thyroid to produce too much of T4 hormone. So it is the common cause. Next question. An 83 years woman has several ecchymotic area has on the right arm. The bruise are probably caused by which of the following reason? So the options are increased capacity, fragility, and permeability, increased blood supply to the skin, and self-inflicted injury and elderly abuse. So here the correct answer is the first one, increased capacity, fragility, and permeability. So here the ecchymotic area is a kind of an discoloration of the skin resulting from the bleeding underneath, or typically caused by the bruising area. On the images you can see. Next question. Among the following clients, which among them is high risk for potential hazards from the surgical experience? So the options they are given with the age group, that is 67 years old client, 49 years, and 33 and 15 years. So here we all know that the elderly person having the highest risk for potential hazards from the surgical experience, because they are less effective immune system. The next one, current has been diagnosed as ablastic anemia. The nurse monitors for the changes in which of the following physical function? The options are bowel function, peripheral sensation, bleeding tendencies, and intake and output. So here the correct option is bleeding tendencies. Here the reasons are the ablastic anemia were mainly decrease the bone marrow production of RBC, even WBC and platelet. So the client is on the risk of bruising and bleeding tendencies. So the next one, which of the following drugs should be withheld in the hemodialysis? Insulin, calcium preparations, and digoxin, and antihypertensive drugs. Here mostly the two drugs should be avoided in case of hemodialysis procedure time. That is, one is blood pressure medication, that is a antihypertensive drugs, and another one antibiotic medication. So these two medications should be avoided when you are doing the hemodialysis. And the next question, after a long leg cast is removed, the male client should do what activities? Options are cleans the leg by scrubbing with that brisk motion, Put the leg through full range of motion and report any discomfort or stiffness to the physician. Elevate the leg when sitting from the long period of time. So here the correct option is D. The elevation will help to control the edema that usually happens after the long cast. 45. The nurse should instruct the client to eat which of the following foods to obtain the best supply to the vitamin B12: dairy product, vegetables, grains, and broccoli. So the correct option is dairy products. So on the vitamin B12 is naturally found in animal products including fish, meat, and poultry, egg, and milk product. So among the option, this is the correct one, and remaining all three is belongs to the plant foods. So among the plant foods, the vitamin B12 is not present usually. And 46. Which of the following medical condition is commonly found in client with bulimia nervosa? The options are allergies, cancer, diabetes, and hepatitis A. So here the correct answer is allergies. This is the very often we can see among the medical condition. And 47. Which of the following symptom is common in asthma? That is that parking cough, bradycardia, dry and productive cough, and wheezing. So we all know that it is very simple answer. That is, a wheezing is one of the common sign when you are assessing the asthmatic patient. So mainly when they are exhaling the air from out of the chest, they used to feel the wheezing. So next question. Which of the following area is most common site of cancer in children? Lungs, genitalia, bone marrow, and GI tract. So the correct option is bone marrow. That is a kind of an leukemias which are cancer of the bone marrow and as well the blood. Very often we can see with the children's. Out of all the cancers, the 28% of the cancers is belongs to the bone marrow and blood related cancers. And 49. Which of the following adverse reaction may occur with the administration of erythromycin? The options are weight gain, constipation, increased vomiting, and nausea and vomiting. So the correct option is, so nausea and vomiting is very often usually will used to happen when you are administering the erythromycin drug. And the next one, 50th question. The following are the functions of the kidney except the formation of erythropoietin, formation of urea, maintaining water balance, and maintaining acid balance. So here the correct option is urine is not the actual function of the kidney. So this is the correct one. So for that, remembering the function of the kidney, one of the easy mnemonic you can remember, that is a wet bed. A for maintaining acid balance, and W for maintaining the water balance, and E for electrolyte balance, and T for toxin removal, and B for blood pressure control, and E for making erythropoietin, and D for vitamin D metabolism. So this is the common function of the kidney. So that's all about this complete video, and rest of the remaining questions we'll discuss in the upcoming videos. And for checking the question number 1 to 25, you can go for the playlist or you can go for the video description. And thanks for joining with me. We'll see you in the next video. Thank you.